So menopause, in essence, is when the female hormones estrogen and progesterone drop to very low levels. It's the end of a woman's reproductive life. And generally that happens around the age of 50 years. It's defined as 12 months since your last menstrual period. And then you're in a postmenopausal phase. So when you think about the fact that the female hormone levels drop so low, you can imagine that the impact that it has on a woman's body is really very significant. And it truly affects every part of the body. Yes, definitely affects the skin, and we'll get into that in a little bit more detail in a moment.
Why is estrogen so critical as a hormone for health, and how does this loss manifest in the face and body?
So the highest proportion of estrogen receptors on the skin are on the face, the scalp, and in the vaginal area. And so it's not surprising that if you take estrogen away, those are the areas that get impacted the most. And you may see that through hair changes, obviously the hydration and the lines and the wrinkles and the quality of the skin of the face, but even oil production changes as a result of the change in hormone levels. And obviously women would be acutely aware of vaginal changes that occur as well. HRT, the topical estradiol rubbed on the skin, is effective, but it's not designed for that use specifically, and it is an estrogen. And so you apply it on your skin, on your arms or your abdomen, because you know it gets absorbed and therefore is a form of HRT systemically throughout the whole body.
That's right.
And the same thing's going to happen when you're applying it to your face. So the first thing is that not all women can use HRT. You know, for example, if someone's had breast cancer or they've got an estrogen-dependent tumor or something like that, then you need to use estrogenic compounds very, very cautiously. And most of the time, you wouldn't use them at all in those sort of situations. So MEP is the specific molecule within the Emepelle range that binds to the estrogen receptors. But there is a day serum, a night cream, and an eye cream in the range. And it is combined with other products, other molecules that are very, very useful in maintaining the health of skin. So you've got retinol and niacinamide, peptides, a whole heap of other things in there which will make the skin look better, feel better, and have those other benefits you want as well. So it's a very clever way that they've combined the ingredients so that it's basically everything you need in a very simple skincare range.
I have a special ageless listener offer. Ready to simplify your longevity stack? Our Season 11 sponsor, Melrose Future Lab, is offering ageless listeners 40% off your first time capsule order. Just use the code AGELESS at checkout. T's and C's apply. Offered valid on one-time purchases of time capsule. Only available now at melrosefuturelab.com.au.
Dermacosmetica, we pride ourselves on choosing products that have got scientific evidence behind them. We like to be able to offer products that we know are going to work. And Emepelle, I classify Emepelle as a high potency therapeutic skincare product. So it's not a cosmetic. And I'm cautious about getting people just to retail it off the shelf. I think it needs to be prescribed by, whoever your skincare professional is after consultation with you, because it has high potency actives in it. Some people need to have it introduced slowly. Some people with certain sensitive skin types should have that sensitivity addressed first. Once people get onto it and they can tolerate it, and most people can, don't get me wrong, the results are outstanding.
I want to go back to what you were saying before about the combination of ingredients. And you said, you don't give up on the other active ingredients that you need for good skincare. So can you take us back a step and say, okay, what would a good skincare routine look like from the perspective of rapid collagen decline in a perimenopause or menopausal state? And what other treatments do you recommend that really deliver?
Yeah, sure. I think it's important to understand what we need for our skin changes as we age as well. And I think if we talk in general terms, people will often comment that perhaps when they were younger, their skin was quite oily, very acne prone. And then when you talk to a woman at the other end of life postmenopausal, she'll report that her skin is actually quite dry and is lacking that oil. And I think one of the traps that we can fall into, we might find a great skincare routine when we're in our 30s, which might contain some retinol, some niacinamide, some antioxidants, vitamin C, or superoxide dismutase, or ferulic acid, or whatever it might be. There's several things that I might touch upon. I'll start with the last bit first, maybe, as to why we are where we are at the moment. And I really think that the Women's Health Initiative study in 2000, which stopped basically the use of hormone replacement therapy for 10 or 15 years in 2002, is a major reason why we are where we are now. Basically, it didn't even stop, it went backwards.
It really did.
Menopause became a taboo topic. There was no way of managing it. All the treatments were terrible. They caused cancer, they caused heart disease. You just wouldn't want to touch it. And it's really a pity the way that came out, because that really did have a devastating impact on women's well-being, but also an impact on the education that doctors had as well. There's a whole generation of doctors who went through medical school and training believing that there was no effective treatment for menopause because whatever you did was putting women's health at risk.
You're listening to the highlights edit of a longer episode. If you enjoyed this clip, be sure to download and listen to the full episode.